When most people hear psychedelics, they think counterculture or uncontrolled use. But in medicine, something very different is emerging. We're beginning to explore how altered states under careful guidance can restore resilience and coherence in the human system. In the ER, I meet patients at their darkest moments, the worst day of their life. Severe depression, burnout, even suicidal despair. But I've also seen the research where controlled clinical trials, the use of psychedelics help people reclaim hope, connection, and vitality when everything else they tried failed them. Here's why this matters for health optimization. At their core, psychedelics act on serotonin receptors and neural networks, dissolving rigid patterns, reconnecting circuits, and it's not necessarily just psychological. It's neurochemical and it's bioenergetic. If we look at trauma or chronic stress, it essentially locks the nervous system in a type of survival mode. And psychedelics in the right setting can create a reset and relax that need to be in a persistent survival state. Now, within the HOMe framework, this connects directly to a couple pillars, the first being bioenergetics. Because psychedelics can shift how mitochondria manage energy, sometimes this actually unlocks efficiencies that were being blocked by that chronic stress state. Additionally, the other pillar is the neuroendocrine integration side. Because they recalibrate the stress response itself, they actually modulate the hypothalamic pituitary axis, stress hormones, and emotional regulation. Together, that reset in energy and stress biology gives the nervous system room to reorganize and the person room to heal. But let's be clear, this is not a quick fix and it's not for everyone. And the power here lies in the integration, which is what's missing most of the time in recreational use. When psychedelic-assisted therapy is paired with metabolomics, lifestyle anchors, and personalized correction strategies, it transforms from being just an experience into lasting change. Think of it as a controlled reset button. And used wisely, it can move these patients out of survival into resilience, adaptability, and further connection. I've seen despair push people to the edge, and I've seen the potential for these therapies, when done responsibly, to bring them back. That's why psychedelics used with care may have a role in the future of clinical optimization. Now, this content's for educational purposes only. It's not medical advice nor an endorsement of unsupervised psychedelic use. These therapies should only be considered within controlled clinical and research settings.